Dear students, Assalamu alaikum, and I'm going to talk about IMCI and its exam orientation on today's class. I'm Professor Mahmuda Hassan, from the Department of Pediatrics of Ad-Din Women's Medical College Hospital. What is IMCI? It is an integrated approach to child health that focuses on the well-being of the whole child. IMCI includes both preventive and curative elements that are implemented by families, communities, as well as by the health facilities. Objective of this program, that is IMCI, to reduce significantly mortality and morbidity associated with major causes of disease in children, and to contribute to healthy growth and development of a child. The components of IMCI are three main components: improving case management skills of healthcare staffs, improving overall health system, improving family and community healthcare practices. For whom and why this IMCI? For the healthcare worker at the primary healthcare facilities, it is used by the healthcare providers at the primary healthcare centers, not used by the doctors at tertiary care hospital like your Ad-Din Medical College Hospital. And you have to know it as a part of national program and as a part of your syllabus. And you have to know to appear in the exam, because you have to face the problems in different way from IMCI. So you have to know it. And you have to follow the referral note given by the healthcare providers to you with the patients, and to grab the child very quickly for quick management and to save lives. The target age of IMCI strategy from day 1 up to 5 years. The classification of the disease are done by color coding systems, and its equivalent management approaches are used according to the severity of the disease that I'm going to mention you in the next slides. Major symptoms assessed in all sick children. The method of managing childhood illness, how to assess the patient, that is the children, and how to classify the disease of the children, and how to treat the patient, and how do you counsel with the parents or caregivers. As I have told, color coding system is used in IMCI. The green color, yellow color, and the red color. For green color, this classification is mild classification and you have to give home care management. Yellow classification, the moderate classification, and management with medications, and advice when to return immediately, and advice for follow-up visit. And red color for severe classification, and you have to refer the child urgently to the hospital with some medication before referral and with a referral letter. The process of management of a case of IMCI strategy for children 2 months up to 5 years. Whatever is the presentation of a child, for each and every child, you have to ask for general danger signs. What are the general danger signs? Convulsion, lethargy or unconsciousness, not able to drink or breastfeed, or vomits everything. And you have to assess for the main symptoms, as I have told: cough and difficult breathing, diarrhea with dehydration, then fever with malaria or measles, assess for malnutrition and anemia, ear problem, and other problems. And you have to asks for immunization status of the child, and you have to give vitamin A supplementation as well. And then after asking all these things, you have to classify the condition and identify the treatment action you need to give for the child. For red, if the classification is red one, you have to refer the child urgently to the hospital. If the yellow one, you have to treat at home, but here it is written referral no. You have to treat the child at home with some advice that I'm going to tell you later in my next slides. And if the classification is the baby is in green zone, you have to give home treatment with some advice. The objective of the objective is to reduce global mortality and morbidity associated with major cause of diseases in children, such as I have told in my previous slides, pneumonia, diarrhea, fever with malaria or measles, ear problem, malnutrition and anemia. And to contribute healthy growth and development of a child, and assess for malnutrition, and give vitamin A supplementation. The target age, as I have told you, from birth or from day 1 up to 5 years. But this age group is divided again into 2 subgroups. From day 1 up to 2 months is one group. The another group is from 2 months up to 5 years. In IMCI, these 2 age group is important, and disease management and is different, disease pattern is different in these 2 groups. So suppose a young infant of 15 days old, the baby may have severe bacterial infection, may have umbilical infection, may have jaundice, deep jaundice, may have profuse discharge from eyes, like that. But in older children, the disease pattern is different. As I have told, cough and cold, difficult breathing, diarrhea with dehydration, ear problem, may have in measles, fever with measles or malaria, may have malnutrition and anemia, may have other problems, and you have to assess a child of 2.5 months for immunization, and you have to assess a child of 1 year for vitamin A supplementation, like that. For this reason, the age group is divided into 2 parts for the classification of the disease, and management of a child as per IMCI is different in these 2 groups. So this is the reason behind that. Principles of integrated care from 2 months up to 5 years. All sick children should be examined for general danger sign. So, not able to drink or breastfeed, vomits everything, convulsion, and abnormally sleepy or difficult to awaken or lethargic and unconscious. So, this may be an MCQ in your written. Question will be like that. Following points are true for general danger sign. Not able to drink or breastfeed, vomits everything, wheeze, convulsion, severe chest indrawing. So here the true one is number 1, number 2, and number 4. So these 3 are your true answer. Here I want to mention one thing. It is easy to remember the general danger sign, how the 2 symptoms from gastrointestinal system and 2 symptoms from nervous system. So not able to drink or breastfeed or vomits everything, and convulsion and abnormally sleepy, lethargic or unconscious. So you have to remember this for general danger signs. In your viva, you may ask for what are the major symptoms that can be treated with IMCI. Cough and difficult breathing, diarrhea with dehydration, fever with malaria or measles, ear problem, check for malnutrition and anemia. These are the major symptoms you have to treat as per IMCI. Here, before going to the color coding charts, I want to tell you, you don't need to examine a child as per IMCI with the stethoscope for cough and cold and difficult breathing. And for the whole system, you have to either you have to ask, you have to listen, and you have to look. But you don't need to examine the child for IMCI. So what you have to do, you have to ask. For general gender sign, you have to ask. And you have to listen. Now I'm going to tell you. And you have to look. What you have to look, then that I'm going to tell you. You have to look for, you have to ask for general gender sign, or you have to look for chest injury. Here it will be severe chest injury in red zone, or you have to listen for stuttering cum child. If any one of them is present, the baby will be suffering from severe pneumonia or very severe disease. So what to do for the treatment in this child? As per IMCI, you have to give first dose of appropriate antibiotic, that is as a pre-referral treatment, and refer urgently to the hospital. In my next slide, I'm going to detail about the referral system and the drugs and the way of refer, how to refer a child to the hospital from a primary care center to the tertiary care hospital. And here the color codings are red, yellow, and green. This is the older classification, but as per WHO classification of 2014, here the points are any general gender sign or severe chest injury or stuttering cum child. So a little bit different from this one, and it is written in your book. You should follow the classification of your book. Here, fast breathing or chest injury. So what is the difference here? The severe chest injury, here is chest injury. So you have to look for fast breathing. And now I'm going to tell you in my next slide what is fast breathing. If any one of them is present, the baby will be classified as pneumonia. You have to give first dose of oral antibiotic for 5 days. It is generally amoxicillin or cotrimoxazole. Soothe the throat and relieve with cough with safe remedy. Advise the mother when to return immediately and follow up after 2 days. If no signs of severe pneumonia or very severe disease or no signs of pneumonia, then it is no pneumonia, only cough and cold. If cough more than 30 days, then refer for assessment. And you have to refer it to the tertiary care hospital. Otherwise, soothe the throat and relieve the cough with safe remedy like tulsi water, honey, etc. Advise the mother when to return immediately and follow up after 5 days if there is no improvement. Child with severe chest injury usually have severe pneumonia, or child may have another serious acute lower respiratory infection such as bronchiolitis, pertussis, or wheezing. Sorry. And as I have told in my previous slide, you have to assess, you have to look for fast breathing. From 2 months up to 5 years, when you call it as fast breathing. From 2 months up to 12 months, if the respiratory rate is 50 or more than 50, then it is fast breathing. If from 12 months up to 5 years, if the respiratory rate is 40 or more than 40, then it is fast breathing. And what about the babies from day 1 up to 2 months? The rate is 60 or more than 60 breaths per minute, then it is fast breathing. And you may have question MCQ from this cutoff value as well, that I'm going to discuss in my next slide. This is a question for your SAQ. It is a very common question in your final professional exam. I have seen it for several times in your SAQ. A 15 months child presented with cough and cold for 3 days with severe chest injury and a stridor for 1 day, no general danger sign. What is your classification as per IMCI? How will you manage the child as per IMCI? The first answer of the first question will be severe pneumonia or very severe disease. And the answer of the second question, you have to give pre-referral treatment and refer the child urgently to the hospital. And you have to give antibiotics as a pre-referral medication, intramuscular, mostly penicillin or amoxicillin and gentamicin. And first dose of antibiotic you have to give before referral. As I have told, give breast milk if not available. If the baby is with the caregivers, then breast milk substitute or sugar water, which will provide glucose to treat or prevent hypoglycemia on the way to the hospital. If the baby cannot able to drink or breastfeed directly from the breast, then you have to give nasogastric tube and then try to feed the baby with the nasogastric tube to prevent hypoglycemia on the way to the hospital. If the child cannot swallow, as I have told, and keep the baby warm on the way to the hospital to prevent hypothermia. And if you listen wheeze, then nebulize the child with salbutamol and refer the child with the referral note with the classification and what type of treatment you have given as a pre-referral medication. What you have given, you have to write it in your pre-referral note. Another question, it is also I have seen several times in your SAQ in final professional exam. An 11 months child presented with cough and cold for 3 days with chest injury and fast breathing for 1 day. What is your classification as per IMCI? How will you treat the case as per IMCI at OPD? So here you can assess the OPD treatment is either in the blue zone or yellow zone or in green zone. Here the baby having cough and cold and fast breathing. So this is yellow zone, and in the baby will be in yellow zone, and the baby having pneumonia, and you have to treat the child from OPD and the treatment will be taken at home. So let's see. So your answer is new baby is suffering from, that is, I will classify the child as pneumonia. The answer of the question 2, the appropriate antibiotic for 5 days. Example, amoxicillin or cotrimazole for 5 days. Advise the mother when to return immediately. When the baby will come, if there is any general danger sign, like not able to drink or breastfeed, vomits everything, convulsion, abnormally sleepy or difficult to awaken, lethargic or unconsciousness. And if there is any signs of severe pneumonia like stuttering, calm child, severe chest injury. Otherwise, if everything is fine, the baby should have come for follow-up after 2 days. So antibiotics are cotrimazole 2 times daily for 12 hourly for 5 days, amoxicillin 3 times daily, 8 hourly for 5 days. As I mentioned, when to return immediately if there is any general danger sign, these 4 signs, or stuttering, calm child, severe chest injury. I have already mentioned. And as I have told, the cutoff value of a child having respiratory distress to classify pneumonia, you may have question in your MCQ like that. 9 months child presented with respiratory distress Following rates are true for pneumonia. 50 breaths per minute, 55 breaths per minute, 38 breaths per minute, 40 breaths per minute, or 70 breaths per minute. So let's say 9 months, that is, you have to remember the cutoff value for this age group. So the cutoff value was 50 or more than 50. So here the true answers are 50, 55, and 70. That is, the A, B, and D is your true answer. In your short case, the question will be like that: you have 2 short case in your final professional exam from pediatrics. So you may ask for classify the child as per IMCI, the baby having cough and cold and difficult breathing. Look at the chest and classify the child as per IMCI, and the age of the child is 15 months. So the question will be like that. So you have to look at the child. You have to ask for general gender sign. You have to look for fast breathing or chest inroing. You have to listen for straddle, and then you have to classify. And classification as per color coding system. As I have mentioned, you have to do the classification on that way. And you have to see the patients in bedside, and you have to classify on bedside as well. It is a practical session, and you have to know it from practical class. So you have almost finished the classification of a child with cough and cold, difficult breathing. The next one is diarrhea with dehydration. Classify diarrhea, and for dehydration, classify diarrhea. You have to classify the dehydration for diarrhea. So diarrhea, you will get it from history, and you have to assess the child for signs of dehydration. So what are the signs of dehydration? If color coding system is same as that of the cough and cold, difficult breathing, the red, yellow, and green. In red zone, 2 of the following if present, like lethargic or unconsciousness, sunken eyes, not able to drink, or drinking poorly, skin pinch goes back very slowly. That is, when it takes 2 minutes, 2 seconds or more than 2 seconds, then we will call it that the skin pinch goes back very slowly. If any 2 of the 4 is present, then you will classify the child as severe dehydration, that is acute watery diarrhea with severe dehydration. And how will you manage the child? You have to treat the child with as per plan C that I'm going to discuss in my next slides. And also assess the child for any other severe classification. Referred urgently to the hospital and you have to give or advise the mother to give frequent sips of ORS on the way to the hospital, and advise the mother to continue breastfeeding if the baby can feed properly from the breast. If the child is 2 years or older than 2 years and there is cholera in your area, then give antibiotic before referral to the hospital. So you have to remember these 4 signs for severe dehydration. Another, if 2 out of 4 is present, then you have to classify it as acute watery diarrhea with some dehydration. If the baby is restless, irritable, sunken eyes, drinks eagerly or thirsty, and skin pinch goes back slowly. That is, when the skin pinch goes back within less than 2 seconds, then we call it skin pinch goes back slowly. When it takes more than 2 seconds, then we will call it skin pinch goes back very slowly. That I'm going to mention and explain in my next slides. So in neonatal, some dehydration, and you have to treat the child as per plan B. And you have to give other fluids like Dove water, green coconut water, chicken soup like that, zinc supplementation, and management of plan B by oral rehydration solution. If the child have any other severe classification, refer urgently to the hospital by giving sips of ORS on the way to the hospital, continue breastfeeding, and otherwise, if only having the signs of some dehydration, then advise the mother when to return immediately and follow up after 5 days if the baby is not improving. If not enough signs for classification of severe pneumonia, severe dehydration or some dehydration, so in that case the baby is suffering from acute watery diarrhea with no dehydration. So in that case, the treatment plan as per IMCI will be fluids to prevent or to give oral feeds like breastfeeding or other liquid foods like chicken soup, chira pani, green coconut water like that, zinc supplementation, and food to treat diarrhea at home. And you have to give oral rehydration solution to prevent ongoing loss. Advise the mother when to return immediately and follow up after 5 days if not improving. You may have question like this: 11-month child weighing 9.5 kilogram presented with loose or watery stool for 2 days, baby having sunken eyes and lethargic. What is your classification as per IMCI? Plan of management as per IMCI. So your first answer will be acute watery diarrhea with severe dehydration, plan of management as per IMCI. You have to give IV treatment quickly. If the child can drink, give ORS by mouth until the drip is running. So this is the fluid management of a child with severe dehydration. What to do? You have to divide the age group in 2 groups, and you have to assess first the age of the child less than 12 months or more than 12 months up to 5 years. And in these 2 age groups, the duration of the fluid requirement is different. For less than 12 months, you need to treat the child for, you have to replace the fluid within 6 hours. And if the child is 12 months up to 5 years, you have to replace the fluid within 3 hours. So here is 6 hours, here is 3 hours. So for less than 12 months, the time duration of replacement will be double than that of the child from 12 months up to 5 years. And the amount of fluid is 100 ml per kg. And the type of fluid is cholera saline, Ringer's lactate solution, like that. Or even if it is, nothing is available, then you have to start with normal saline. And you have to reassess every 1 to 2 hourly. If hydration status is not improving, give IV drip more rapidly. Also give ORS 5 ml per kg per hour as soon as the child can drink. Usually it takes about 2 to 4 hours in infants, 1 to 2 hours in children. You can start the ORS even after having IV fluid. Reassess after 6 hours and classify the child again whether the baby is still having severe dehydration or some dehydration or no dehydration. If severe dehydration, plan C. If some dehydration, plan B. If no signs of dehydration, you have to continue the treatment as per plan A. So weighing 9.5 kilogram, fluid is 100 ml per kg and total fluid is 950 ml. First hour, as the age of the child, as I have told you, if it is less than 12 months, so in first hour, you have to give, more than 12 months, if the age of the child is less than 12 months, so in first hour you have to give 30 ml per kg. So total fluid in first hour will be 9.5 kilogram into 30, that is 285 ml. And next 5 hours, you have to give 70 ml per kg. So total fluid for the next 5 hours is 665 ml. So total duration of fluid correction is 6 hours in a child less than 12 months. Then again assessment for the pattern of dehydration after correction. You have to give zinc if the child can able when the child is stable, and continue breastfeeding, green banana, yogurt, chira pani khichuri, green coconut water, like that. And the problem you may have a child for diarrhea with dehydration, and it is very common question in your OSPE. How will you manage a child of 11 months having loose motion or loose stool for 3 days? Baby is irritable and eagerly thirsty. What is your classification as per IMCI? Acute watery diarrhea with some dehydration. So the child is in yellow zone. Plan of treatment. How will you treat the child as per IMCI? In some dehydration, plan B, ORS should be given 75 ml per kg over 4 hours. In severe dehydration, as the age of the child is 2 years, cholera saline or Ringer's lactose solution, 30 ml per kg over 30 minutes, and then 70 ml per kg over 2.5 hours, and then reassess the child and set the plan of management according to the condition of the child. So look at the question again. How will you manage a child of 11 months having loose stool for 3 days? The baby is irritable and eagerly thirsty. For this reason, your classification is some dehydration, acute watery diarrhea with some dehydration, and you have to manage it with ORS within 4 hours, and the amount of ORS will be 75 ml per kg. In severe dehydration, when the child is more than 12 months, when the age is 2 years, then cholera saline, and the amount of fluid will be 100 ml per kg, but duration of fluid that you have to give for this child will be 3 hours. In first slot, you have to give 30 ml per kg over 30 minutes, and then 70 ml per kg over 2.5 hours. And assessment will be like as I have mentioned in my previous slide. So if the baby having diarrhea for 14 days or more, if dehydration present, the baby will be in peak zone. So classification will be severe persistent diarrhea, treat dehydration and refer urgently to the hospital. And as the child having, if the child having another severe classification, you have to refer the child to the hospital. If the child having diarrhea for 14 days or more, but no dehydration in yellow zone, and this is persistent diarrhea, advise the mother on feeding a child who has persistent diarrhea. You have to continue feed, give multivitamins and minerals like zinc for 14 days and follow up after 5 days. If the baby having diarrhea but is blood in the stool, yellow zone, and this is dysentery, you have to start ciprofloxacin. Here it is 3 days. Usually we do practice with 5 days and follow up after 3 days. In IMCI, it is 3 days. So all about today, I have mentioned the classification of cough and cold with difficult breathing, and that is the pneumonia, severe pneumonia, and no pneumonia, cough and cold, and their related questions, and I have discussed about diarrhea with dehydration, diarrhea with severe dehydration, some dehydration, no dehydration. Also, I have classified the child with severe persistent diarrhea, and dysentery. So that's all about today from IMCI. I will take another class from IMCI that is left. Otherwise, it will be a very lengthy class. In my next upload, I will take the classes on fever with malaria or measles, child, how to assess for malnutrition and anemia, and the relevant questions like that. So thank you very much from today. And you have to, thank you very much, everybody. And for my next class, get ready for that and try to remember the questions that is important for your MCQ, SAQ, or a Viva. So thanks again.